Folks, thanks for coming on the line with us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so giving your clients something to smile about. We'll spend some time today discussing one of the dental programs rolled out by one of our featured partners, Medico. A little bit of information about us first. In addition to giving you something to smile about with this program, we do try to do other things with you to help you smile about a whole bunch of different things, as we are one of the largest national marketing organizations in the country. We're part of Integrity's marketing program with offices across the country, and we provide insurance services through independent insurance agents with contracts that are vested and at the highest possible commission levels with recruiting contracts available as well. We are celebrating our 50th anniversary this year, so we're a company that has a lot of experience behind it, and we are one of the largest producers with many of the Medicare Advantage and Medicare supplement companies that are available to you in the market. We have a full portfolio of insurance products. I work in the Medicare division, but we also have folks that concentrate on life insurance, long and short-term care, disability income, and we do offer a full portfolio of ancillary products, such as the one we're going to discuss today. That full Medicare Advantage product selection varies across the country. It gives you a lot of options with different national carriers and some regional carriers as well, along with the prescription drug portfolio that's necessary for you in certain Medicare Advantage and, of course, in Medicare supplement programs. That full Medicare supplement portfolio does feature a number of Medicare supplement programs with the support of Medico. They have a great marketing program and incredible agent support with electronic enrollment functions, something that we'd urge you to look at in some of our other recordings with Medico as well. So speaking today of having something to give your clients to smile about, we have invited, and she has graciously agreed to give us a presentation on the dental product, and we're featuring today Ms. Carrie Hobbensock with Medico Insurance. So at this particular point in time, we're going to ask Carrie to take it away and give us some idea as why we should sell dental with Medico. Carrie?
Great. Thank you so much, John, and we really appreciate this opportunity today, because there's not only a risk of financial hardship due to not having coverage for dental services, there's also health risks that are associated, because when individuals don't regularly visit their dentist, maybe because they don't want to pay for their services, especially in the senior market, as they're no longer part of maybe a group dental plan, then they're subjecting themselves to potentially hazardous health conditions. And we're going to talk more about both of those aspects today. So Medico has been selling dental insurance since 2008. We were actually one of the first carriers in the individual marketplace. And with all that we do offer you, from all of our products and agent support and the electronic application tool that John mentioned, really our overall main goal is to just make doing business with us as simple and easy as possible. And one of those items, as John did already mention, is My Enroller, which is our quoting and our application processing tool. And it can be used with or without an internet connection, so it's actually great if you download it on your desktop, your laptop, or your iPad. You can actually use this when you are face-to-face with a client or when you are selling to them over the phone, because there are voice signature options as well as an electronic signature option for you to use, which then makes it very, very easy for you to, any situations where you are selling multiple products at one time. It's like a great cross-selling tool from that regard. And then, of course, your applications are going to be sent electronically here to Medico, which means those policies are going to get issued very, very quickly, and then you'll get paid sooner as well. And where you're going to find My Enroller is on Medico Information Center, or what we like to call MIC. That's at mic.gomedico.com. Again, you're going to be able to find and download My Enroller here, as long as, or in addition to many other tools that you have access to, underwriting guidelines, all sorts of product information, all sorts of marketing materials, and all of your commission information is housed here as well. So here's what we're really here to talk about today. So why is it so important for you to talk to all of your clients about dental coverage? So nearly 40% of seniors have not had a dental visit in the last year, which means that more dental ER visits actually occur. They occur about every 15 seconds. And even if your clients think they are, you know that they're not covered by Medicare. Medicare does not cover the majority of dental services, including cleanings, x-rays, root canals, dentures, and a whole lot more. And as you can see here, as consumers age, the number of those individuals with dental coverage does decline, which then can lead to the health issues that we're going to talk about here in just a second. Because what happens at around age 65, right? Your clients are dropping off their group coverage, and most of them do not know that standalone dental plans are available to them. The product does offer you a great cross-selling opportunity with either your MAPD clients or those with Medicare supplement plans. Of the 54 million Medicare beneficiaries in the United States, well over half of them either do have an MA or a MedSup plan. And this can be a great, get in the door conversation as well, even if your client does not have any healthcare coverage at all, which does, equate to a pretty significant number of the population. So if your clients don't have dental coverage, this is a chart that shows you the average cost of dental services that are occurring across the country. So with dentures costing around $2,200 and crowns at $1,500, root canals $1,100, fillings are $300, and even cleanings can be around $130 a pop. It's no wonder that 40% of that senior population has not been to a dentist in the last year. And I mentioned this briefly before, there is a very important health aspect if you're not going to the dentist on a regular basis, because preventive dental care can actually cut down on the total out-of-pocket costs that your client might see by reducing that possibility of needing any major dental services. And it can even reduce the need for additional doctor visits and other procedures, because poor oral health is actually linked with respiratory disease, cardiovascular disease, and also diabetes. Periodontal disease does affect more than 70% of adults over the age of 65. And 62 is actually the average age for most people that are diagnosed with mouth, throat, and tongue cancer. So all of this information that we've actually gone through so far on the financial side, the health side, this is great information to share with your customers on an annual policy review, maybe during AEP, or really at any time during the year, just to get this conversation started. So let's talk a little bit about Medico's actual product solution. So first, it's important to note that it is an individual plan, and it is available for anyone between the ages of 18 to 89. And the plans we're going to discuss today each have a $100 deductible and varying levels of coverage for all of preventive, basic, and major services. So we'll go to that slide now. And so this is probably a little bit hard for everybody to see, but this is our entire dental portfolio, and you can choose from maybe if your client only wants dental, no vision, no hearing services or coverage, they can certainly choose a dental only plan. We do have dental, vision, and hearing products that have an increasing coverage feature on a yearly basis, and then we also have a $2,500 maximum benefit product. So let's start with that dental only plan. So here you're going to find a $1,000 annual maximum. This is for your customers who do regularly visit the dentist for preventive care. Maybe they are doing their routine cleanings. They're looking to keep their teeth healthy and they just want backup coverage for basic and major services. This is a good plan for them. That middle plan, what we are calling DVH, you can select between $1,000 and $1,500 for your annual maximums here. This is definitely for your customers who want immediate coverage for their basic services. They might worry about the cost of major services and want to have some protection there. And this is also for your clients who do have an interest in hearing and vision coverage. You can see the increasing level of coverage based on the policy year. And again, no waiting period for basic services that might include diagnostic x-rays, fillings, any non-surgical extractions. And you also have no waiting period on your eye exams as well. The Dental Plus plan, which is the last column there, this is for your customers who do have a dental condition or a concern with their dental health. Maybe they worry about the cost of major services. That would include a possible implant that they might need. This plan does pay for implants, which is an important notation. This is also for your customers who do have, again, an interest in hearing and vision coverage. And you'll see the plan here is paying at 80% for preventive and basic services and at 50% for your major dental services, and again, plus vision and hearing. Some other important things to understand about this particular plan: it truly is an insurance policy. It's not just a dental card, which is going to give them reduced prices at the dentist. It's an actual insurance plan. Again, we went over the many different options that are available to them depending on their need and their budget. And this is a guarantee issue plan. There are no health questions on the application. And the premiums are going to stay the same as they are when the time this policy is issued. The rates are not going to increase every policy year based on an anniversary or a birthday. And then there is a passive provider network that is included in this. And on the next slide, we offer a little bit more information to show how your customers have the freedom to visit any dentist that they choose, knowing that their plan is going to keep them covered. And for your customers who are looking for the most savings, they can choose to visit a dentist in the Carrington, or also known as the Dentamax network. We do not coordinate any benefits, so your client may use this Medico Dental product along with any other dental or another health insurance product that they currently have. This plan is available in the majority of states, just a handful where they are not available. I know we get a lot of questions on that from time to time, so just want to make sure that everybody understands that. And I mentioned there's not an attained age premium adjustment on these plans. So here you're seeing a little snapshot of what the monthly prices would be for the dental only plan. The DVH, which offers the $1,000 benefit, the dental vision and hearing, which offers the $1,500 benefit, and then that $2,500 dental plus product. And this is age banded. You can use my enroller to get a quote. We have a very easy rate sheet that's available on our website. And then you can also even call for Premier to get a quote, or you can use our agent services line as well. One more way you can actually quote any of the Medico products that you might be offering is to use Quick Quote. This is a really easy place to go. You can download it. It's a website, but you can download it as an icon on your smartphone. You can bookmark it on your internet browser just for easy access, and you can get a quote at any time for any one of our products. So I would certainly urge you to go and download that particular tool. So again, you can use all of that great health information. There was a lot of statistics we talked about, the cost of dental services, and then those health risks for not regularly visiting the dentist. But you can also start your conversations with a question or two. Are you aware, Mr. Customer, that your Medicare plan does not cover dental services? Did you have a dental insurance plan through your previous employer? And get the conversation started that way. Or even something as simple as, when was the last time you went to the dentist, to get that conversation again started? Do you know about poor oral health being linked with other diseases? Even things like, have you noticed any pain in your mouth? Or, if you're on the subject of dental and want to make sure that you include the fact that they can also get vision and hearing coverage, are you having a hard time reading or seeing? Are you able to hear clearly on your telephone or in face-to-face conversations? Just some quick, easy questions to get those conversations started. You can also put the conversation in terms of savings, right? So there can be a monthly premium that can be paid, which would mitigate many out-of-pocket costs down the road, which is what you're seeing on the screen here. This is a pretty common scenario, right, where there might be a chance that within a given year, your customer could have their 2 scheduled cleanings, and then they find they might need a filling, which would add another $1,400 to that cost. They might have a crown that needs to be added, vision exam, a hearing exam, and then once that hearing exam occurs, they might find they need a hearing aid, which could put their total out-of-pocket expenses at right around $3,700 just for those particular services. And, Medicare Advantage plans, yes, some of those are going to offer just some co-pays there and might cover part of those services, but still in this particular scenario, you're still looking at an out-of-pocket cost of over $2,300 for an MA PPO type plan. But you are definitely going to see if you help add a dental, vision, and hearing plan to your customer's portfolio, they are going to be definitely saving some money when it comes to paying for these types of services. So it's really important that you bring up this conversation with every one of your clients. Another way to look at it is on the next screen, we also show some different ways if your customers do specifically have a Medicare supplement plan, if they are maybe seeing some rate adjustments that are taking their plan a little bit to a place where they cannot afford it on a monthly basis, maybe taking them down to, maybe if they're on a plan F to a plan G, which would give you some savings on a monthly basis, or even a plan N. And what we're showing here is just an example of what those cost differences would be. This just happens to be in an Iowa zip code, for example purposes, but even adding a $1,500 DBH plan or a $1,000 DBH plan on a monthly basis, still there would be saving a significant amount of money in adding coverage at the same time. And then you see the other example for a Medicare Advantage plan with those same costs included. And if marketing is your thing and you want to make sure that you have access to a whole host of materials that you can utilize before you go out and see a customer, put together a marketing campaign for your existing and potential clients. Maybe you, again, go out and market to them before you actually go see them on a policy review, or if you're talking to them about their health care. And then there's all sorts of materials you can use during that conversation as well. And then also follow-up items if you don't get that dental sale, but want to make sure that you kind of keep in front of them with this type of information. And all of these can be found on our website. And then, of course, we also like to show if you are selling just one dental plan per week, what your approximate annual commissions would be by either selling, again, this is just an example of our DBH plans, just one a week is going to get you about $10,000 in commissions, or about $13,000 in commissions if you're selling that higher benefit plan. And then there's another feature that we like to make sure all of our agents know that they have access to. So in addition to being able to sell, whether you're familiar with enroll, our electronic application tool, which we've already gone over, or if you're just more comfortable selling through a paper application, there is still one more way that you can get dental plans in front of your customer and make it even easier for you to sell dental plans, and that's by setting up your own URL or your own customized website. And how you would do that is by going to our website and going to your profile and setting that up. If you want to switch to the next slide, and then one more. So you're going to go again to Medico Information Center. Once you click on your profile up in the upper right corner, what you're going to see is on the next slide. One more, sorry. You're going to see just basically you're going to identify that you understand the CAN-SPAM Act for when, how to market to your customers over the internet or via email. Once you have just basically clicked off on that, you're going to get access to your own URL. And what we're seeing here, the arrows showing you is also some email templates that you have access to that are already pre-approved that you can send out to your customers. But more importantly, on the next page, okay, and that's just an example of what those pre-approved email messages are. And then what you're seeing here is that that arrow that's going to give you access to your own URL. So once you click on that link, it's going to take you to this website, which shows the circles there are going to show where your name, your contact information is going to be applied on your own, again, customized URL or dental website. What your customers are going to see as they go through this just gives them a chance to actually sign up for a dental plan kind of on their own time. So this might be a nice follow-up if you are discussing dental plans with your customer, maybe they aren't ready to purchase yet, you can certainly follow up by sending them a link to your website, and then they can sign up on their own time. You will get a confirmation once that customer does sign up. They'll get a confirmation as well. But it's just a great way that you can even add this, as a banner ad maybe on your own page, just to get the message out there that you offer dental plans, which would then link to your website here. You can use it in your signature block when you are sending emails out to your customers. So it just makes it really, really easy for you to bring in some additional, again, commission, but also help your clients get additional coverage. And then one more thing before we leave you today is a little bit of information about the incentive program that we have going right now with Medico. And this is for all Medico products, which would include, of course, dental products as well. So how this is going to work, there's actually 3 different ways you can get a bonus payout. And the first one is on a monthly basis. And this is for all of your business that was submitted starting the 1st of May, and it will go through the end of the year as long as you get 4 applications issued and approved, and that can be any product combination of either Medicare supplements, dental plans, hospital indemnity, cancer, or short-term recovery care. Once you hit 4, you are going to receive $100 for each of those underwritten Medicare supplement applications. You would receive $25 for each of your dental, hospital indemnity, cancer, or short-term care applications. And then you would receive $10 for any non-underwritten Medicare supplement, so any guarantee issue or open enrollment plan for MedSup. So that's the monthly portion of the plan. The second piece is a mid-year cash award, and how this works from January. So this kind of goes retroactive to the beginning of the year. So once you reach $50,000 or more by the end of June, so coming up here in a couple weeks, if you're one of those agents who has reached any of these different levels in total sales, you would receive an additional cash award, and you can see those amounts. And then at the end of the year, you have one more chance to receive an additional end of the year award for the production levels at $100,000 and above. And again, that's for the entire year, for January through December sales. Anywhere between $100,000 and $200,000 in sales would give you an additional cash award at the end of the year. So in total, these all work together and can be layered. So if you're earning the monthly payout, again, this is just that shows 3 Medicare supplements that are sold in a given month, and maybe 2 dental plans along with that, could get you $2,800 every month between May and December. And on top of that, if you're reaching the $50,000 level at the mid-year point, you could receive $1,500 on top of that. And then at the end of the year, if you're at a total sales volume of $175,000 as an example, you would receive an additional $8,000, which would bring your total just in bonuses to over $12,000 in addition to the commissions that you'd be earning. So we did go over that information pretty quickly in about 20 minutes, but we would highly encourage you, if you do need more information, you have questions, you need clarification, to definitely call your Premier representative. And you can also get in contact with our agent services team as well.
Awesome. Thank you, Carrie. I think you can see through the presentation today why we like working hand in hand with Medico. In addition to just the complete product portfolio, the agent support, and the extra marketing incentives that they have makes Medico one of our favorite partners to work with. And I think you've seen that demonstrated throughout today's presentation. What we wanted to do is give you some additional reasons why you would want to work with Premier Marketing. We do offer discounted E&O to qualified agents. We work to make certain that your licenses stay intact. So we work with different organizations, including WebCE, to give you discounted means of keeping your licenses through the continuing education credits. We have some additional means of helping you contract with organizations through creating an agent profile and selecting carriers on an electronic basis to fill your portfolio with products. We also offer differing training programs throughout the year. These are also recorded and available to you with different marketing and product programs that help you get in front of folks to offer products such as the Medico Dental program. Additionally, we do offer supplemental quote engines as well for Medicare supplements, information on Medicare Advantage programs, and different ancillary products as well through the complimentary use of our quote engine that is available to agents that contract with our organization. We also contract with a software program that enables you to do some Medicare Advantage and prescription drug plan enrollments remotely, capturing the scope of appointment and the applications without sitting face-to-face with an individual and still doing it compliantly. We do offer also additional marketing programs that help put you on the map with social media through our Coverage Made Easy programs, and give you some additional help getting in front of individuals through different lead programs, such as custom lead lists that are available for you for cold calls for such things as dental and Medicare supplement programs, and also programs that help put you into the community with different community-based marketing programs such as retail marketing, faith-based opportunities, and working with select providers as well, in addition to other means of drumming up folks to visit, including a direct mail support program that allows you to put out mail on a deeply discounted basis. It's based on production on a monthly basis and can really help you get in front of additional folks through working with our organization. What we look to do is use programs such as the Medico Dental program to help you grow your business, help you grow your agency, and we look forward to doing so on a hand-to-hand basis to make certain that once you decide what is to be a part of your portfolio, that you work through that program and make it an integral part of your overall marketing plan. And when you have a program such as Medico's Dental program, a great demand product, it's a great way to open doors for other products in addition to the income you can generate just with that product. But the challenge is you have to actually use it. So what we look to do is make certain that you're contracted and actually actively marketing the program and doing so on a regular basis. What you have in front of you right here is contact information for the Texas office. You can reach any of the marketers with Premier through the toll-free number of 1-800-365-8208. This is information, once again, for the folks here in Texas, but that can get you in touch with any of the marketers that you're working with within Premier and make certain that we can make Medico Dental an integral part of your overall marketing program. We want to thank you for coming on the line with us today and spending time learning more about a great program that can positively influence your agency, and we look forward to speaking with you in the near future. With that said, we wish you good selling. Thanks.